The last section in this chapter is about blood vessels and blood vessels circuits. So the blood coming to the heart is deprived of oxygen. It goes to the heart and then to the lungs, back to the heart and back to the body. So the pulmonary circuit brings in the deoxygenated blood from the body and takes it to the lungs and back to the heart. And the systemic circuit takes it from the body, from the heart, throughout the body, and then back to the heart. Blood is carried away from the heart in arteries and returns to the blood in veins, and the connectors are microscopic, one-cell layered capillaries. The capillaries are where the action occurs. This is where nutrients, gases, and wastes are exchanged. So here's the heart, and the pulmonary circuit is going to start here in the right atrium and take the blood to the lungs to be oxygenated and then come back to the left side of the heart. That's the pulmonary circuit. And then the systemic circuit takes the oxygenated blood from the heart out the aorta to the whole body and on top of the body as well as the lower half of the body, and then brings the deoxygenated, shown here in blue, blood back to the right side of the heart. So this is something you do have to learn, but you'll go over it and over it and over it, and you'll see it multiple times. Eventually it will make sense. So in terms of the layers of these arteries and veins, there's three tunics or layers. The innermost layer is the Tunica Intima, or called the interna. The middle layer is the muscular layer, that's the Tunica Media, and then the outermost layer is the externa or adventitia. The innermost layer is a single layer of simple squamous epithelium with underlying connective tissue, elastic fibers. The middle layer is muscle, so that it can increase vessel diameter, which is called vasoconstriction, or decrease vessel diameter, called vasoconstriction. And then the outermost layer is elastic and collagen for a very tough external layer, tunica externa. So when you look at an artery and a vein, you can actually see the difference. Here's this single layer, the tunica interna, and then the muscle layer is pink in both, and then the tunica externa is beige. And you can see here that the artery has a thicker muscular layer. The vein has a bigger opening. This opening or space is called the lumen, L-U-M-E-N. So arteries carry blood away from the heart and then they branch. The smaller branches are called arterioles, and these branch into even smaller capillaries. And then from the capillaries, the blood flows into small veins called venules, then to veins and back to the heart. Capillaries have very thin walls for easy diffusion of materials between the blood and the interstitial fluid. Atherosclerosis is a thickening of the arterial walls. And this is pretty important in America. Complications of this account for half of all deaths. Some of the effects include coronary artery disease, heart attack, and stroke. Atherosclerosis is the formation of fatty deposits in the middle layer, the tunica media. And this is associated to damage with the inner lining, the endothelial lining. The most common form is arteriosclerosis, and this is often in people with high blood cholesterol. The result is what's called a plaque, and it is fatty tissue that restricts blood flow. And so this opening lumen has decreased because of this plaque deposit in the wall. So we can remove and replace damaged blood vessels, but what's best is to try this balloon angioplasty, and here's a picture of it. So they insert this catheter into the artery and then expand it. It expands like a balloon and pushes the plaque outward. It's not removing it, it's just pushing it outward to open up the blood flow, and they could put a stent in here to keep it open. But this is a very effective for small plaques and low mortality rate. It's just outpatient surgery, very successful. But of course, if you don't change your habits, the plaque is going to grow. It's just going to come back. Now here's a typical capillary bed. So our arteries form smaller arterioles. So there's a smaller arteriole. And we don't worry about the meta-arteriole. But so here's what's called a capillary bed. Here's the incoming blood, and it's going to pass through this capillary bed, and in the capillary it's going to lose nutrients and pick up waste, exchange gases, and then the used up blood is going to come out this venule and then lead to a vein. Well, here at the beginning is a little sphincter. So the blood flow can be prevented from going through this capillary bed by closing down these sphincters. So our blood has this control over where it's flowing. For example, if it's freezing out and you need to keep your blood to your core, you're going to close your capillary sphincters going to your fingers and toes and nose and ears, that kind of thing. Now in the venous system, there's much less pressure. So in the arterial system, the blood is being pushed by the heart, very high pressure. But the venous system, there's not that much push. The pressure is about 10%. And so there's ways that we have to move the blood through the venous system. One is valves, and the other one is contraction of skeletal muscles. So valves, if you think of a pump system that has valves prevent backflow. That's all that valves do, whether it's in your vein or whether it's in your heart or in a water pump, it prevents backflow. So if the valves are not working properly, the blood can pool in the veins and they can distend, and this could cause varicose veins. So here's our valve in the gastrocnemius. It's closed, but then as you're moving that muscle, here's the muscle contracting as you're moving it, the valve opens and blood is forced upward, and even when that valve closed, the blood will not go backward because the valve's in place. So the blood is constantly pushed in the right direction. In our body, most of the blood is in the venous system, 64% in the veins, 7% in the capillaries, 13% in the arteries, 7% in the heart, 9% in the pulmonary circuit, but clearly most is in the veins. So our body maintains blood volume even in the case of hemorrhaging by reducing the amount of the volume of blood in the venous system. Vasoconstriction is controlled in the medulla oblongata, and it will just reduce the blood in the venous system by vasoconstriction. So here you can see the diameter has been reduced. So your blood pressure is going to change depending on how constricted your veins are. We're going to talk a little bit about the circuits here. The pulmonary circuit, remember, is carrying the deoxygenated blood to the lungs, to the heart, and then it goes to the lungs to get oxygenated, and then it's going to return to the left side of the heart. And then the blood from the left side of the heart goes to the system to oxygenate all the tissues, and then it returns back to the right side. pause here if you want to look at this in detail, but oxygenated blood, the arteries is going to be in red and the systemic veins in blue. This shows the blood flow in a little more detail. So here is from the upper part of the body, the blood is coming into the heart. This chamber of the heart is the right atrium. This is called the superior vena cava, and this is called the inferior vena cava. So this is bringing in blood from the whole body. And this deoxygenated blood enters the right atrium, goes through a valve here. This is called the tricuspid valve, and enters the right ventricle. From here it has to go to the lungs. So it goes out this pulmonary trunk, which then divides into pulmonary arteries, left and right pulmonary arteries, and going to the lungs. So then you follow the red. Now it's oxygenated, so it's red coming back to the heart, and it's coming back to the left side of the heart, the left atrium. It's going to go through the bicuspid valve or mitral valve into the right ventricle, and from here it's going to be pushed out the aorta, up to the head, and all the way down through the descending aorta, the thoracic aorta, the abdominal aorta, and the whole body. This is this little picture here is showing what's taking place in the lungs, where oxygen from the lungs is going into the blood, and carbon dioxide from the blood is going into the lungs. We will not be learning all of these. We'll be learning some of the arteries. They're not that, the ones we learn are not that difficult. The aorta, this is the ascending aorta, and down here is the descending aorta. If it's going to the kidney, it's a renal artery. If it's going through the armpit, it's the axillary. If it's going through the upper arm, it's the brachial artery. If it's going to the thumb, it's the radial. And if it's going to the pinky, it's the ulnar. Now over here in the abdominal aorta, it is going to branch to form what's called the common iliac. And then from there, we've got an internal and external iliac. But this comes down here to this femoral artery, which is a really large artery. And if you cut that in your leg, you will bleed out. Those are the most important ones that we'll be learning in the body. We will spend a little time up here with the carotid, subclavian, brachiocephalic trunk. And then the veins basically parallel the arteries, which makes it easy. Instead of the carotid, it's the carotid artery going up. Instead of the carotid vein coming down, it's the jugular. So everything else just about parallels the artery in name and in body part that it sends blood to. Here we've got branches of the aortic arch, which are pretty important. So here's the aorta branching off, and it's going to, there's going to be three main branches. The first one coming off here is called the brachiocephalic trunk, and then it's going to branch into the carotid and the axillary. And then we have our left common carotid and then left subclavian. Going up is the carotid. Look how it passes up. And then look here. Look at this branch here. The vertebral artery is going up through those foramens in the vertebrae up to the brain. The jugular is bringing used blood down. Here's a cool part of the brain. It's called the circle of Willis. But you don't need to know any of this. It's just kind of cool. It's, if you lose a part of one of these arteries has a blockage, it's supplied by other arteries. So we've got sort of a backup system for the brain in case one gets blocked. veins of abdomen and chest, the aortic and all the branches off that aortic, renal, and then the common iliac here. And then all the branches to the digestive tract.